In this video, we are going to cover the pharmacology of expectorants. But before we do that, let's review the drugs used for the treatment of respiratory disorders. As you may already know, there are at least four important categories, and these are antitussives or cough suppressants, drugs for bronchial asthma, pharyngeal demulcents, and last, expectorants or mucokinetics. Let's start with the definition. Expectorants are medication or natural ingredients which can increase the volume of airway secretions and also help clear the mucus from the airways. People may take them to help alleviate congestion due to the common cold or flu. There are two categories of expectorants. The first one is secretion enhancers. Basically, they increase the volume of airway secretions by increasing the amount of water in them. Examples of secretion enhancers are potassium iodide, guaifenesin, tolu balsam, Vasaca, ammonium chloride, Thermopsis grass infusion, and Althea root decoction. The second category of expectorants is mucolytics. They make the mucus less thick and sticky and easier to cough up. Examples of mucolytics are bromhexine, ambroxol, acetylcysteine, and carbocysteine. In order to understand the mechanism of action of secretion enhancers, we should review a couple of histological structures. In the stomach are irritant receptors that can be stimulated by the secretion enhancers. The vomiting center of the brain refers to the groups of neurons that include the chemoreceptor trigger zone (CTZ) within the area postrema and the nucleus tractus solitari. Speaking about the structure of the bronchial wall, I should mention a couple of types of cells, such as basal cells, which basically produce new cells, goblet cells, which synthesize and secrete mucus, ciliated cells, which play an integral role in the defense mechanisms of the respiratory system. By the coordinated beating of their cilia, they provide the force necessary to clear potentially harmful material from the airways. Inside the bronchial glands, there are mucus and serous cells. There are two mechanisms of action of secretion enhancers, direct and indirect. The indirect mechanism is as follows. The drug will stimulate the irritant receptors in the buccal cavity mucosa and gastric mucosa. The vomiting center will be stimulated by nervous impulses from the stomach, intestinal tract, and other portions of the body. When the vomiting center is activated, it will send efferent fibers that will stimulate salivary gland secretion, gastric gland secretions, and most importantly, bronchial gland secretion. Bronchial glands have two types of secretory cells, and these are serous cells and mucus cells. Efferent fibers from the vomiting center will stimulate mucus cells to produce more watery mucus. Because of that, the secretions will become more liquid and their volume will increase as well. If water content in the mucus increases, the viscosity will decrease. All these factors will stimulate the elimination of secretions. Thermopsis grass infusion and Althea root decoction work via the indirect mechanism. As for the treatment with Thermopsis of respiratory diseases accompanied by cough, here comes the alkaloid thermopsin, which irritates the gastric mucosa, stimulating the bronchial glands to produce more mucus. It is due to this that there is an increase in the amount and a decrease in the viscosity of sputum. Thermopsin, together with other alkaloids, strengthens the respiratory function, causes the bronchi to contract more actively, as if pushing the mucus outward. Thus, cough becomes productive and expectoration is less painful. The majority of secretion enhancers, such as potassium iodide, guaifenesin, tolu balsam, Vasaca, and ammonium chloride, work via direct and indirect mechanisms at the same time. So, what do I mean by that? Drugs such as guaifenesin and ammonium chloride can stimulate irritant receptors in the stomach and intestines, then stimulate the vomiting center and bronchial secretion. In other words, they can work via the indirect mechanism. What makes them different from indirect acting agents is the fact that they are well absorbed in the bloodstream, Then the active metabolites are eliminated in the secretions of the bronchial glands. Here comes the direct mechanism. I will represent the drug with this black dot. These substances attract the water molecules. Water content in the mucus will increase and the viscosity will decrease. All these factors will stimulate the elimination of secretions. One important drug for clinical use from this category is guaifenesin. Guaifenesin is thought to act as an expectorant by increasing the volume and reducing the viscosity of secretions in the trachea and bronchi. It has been said to aid in the flow of respiratory tract secretions, allowing ciliary movement to carry the loosened secretions upward toward the pharynx. Thus, it may increase the efficiency of the cough reflex and facilitate the removal of the secretions. Guaifenesin has muscle relaxant and anticonvulsant properties and may act as an NMDA receptor antagonist. Side effects of guaifenesin include nausea, vomiting, the formation of kidney stones, diarrhea, and constipation. Nausea and vomiting can be reduced by taking guaifenesin with meals. The risk of forming kidney stones during prolonged use can be reduced by maintaining good hydration and increasing the pH of urine. The leaves of Vasaca contain phytochemicals, such as alkaloids, tannins, saponins, phenolics, and flavonoids. The most important is vasicine, a quinazoline alkaloid. Vasaca is a very efficient secretion enhancer. Ammonium chloride is sometimes used as an expectorant in cough medicine. Its expectorant properties are caused by irritative action on the bronchial mucosa, which causes the production of excess respiratory tract fluid, which presumably is easier to cough up. Ammonium salts are also an irritant to the gastric mucosa. So, once again, ammonium chloride can act via direct and indirect mechanisms. As side effects, ammonium chloride can cause metabolic acidosis, disorientation, confusion, and coma. Patients administering ammonium chloride should be watched to the signs of ammonia toxicity, including pallor, sweating, irregular breathing, bradycardia, cardiac arrhythmias, local and general twitching, and convulsions. Now it's time to discuss the second category of expectorants, mucolytics. So here we have bronchial glands that secrete mucus. You can see that the amount of mucus in a healthy individual is reduced, but in case of a respiratory infection, the thickness of the mucus layer increases. Mucolytics break down the chemical structure of mucin molecules. The mucus becomes thinner and can be removed more easily through coughing. So let's zoom on a mucus particle here. First, let's answer one question. What is mucus, and what is its composition? Mucus is a viscous colloid containing inorganic salts, antimicrobial enzymes such as lysozymes, immunoglobulins, and glycoproteins such as lactoferrin and mucins, which are produced by goblet cells in the mucous membranes and submucosal glands. The site of action of mucolytic agents is the mucin molecule. So let's zoom inside one. This molecule is formed by a lot of monomers. The cysteine residues participate in establishing disulfide linkages between mucin monomers. Here you can see the disulfide linkages. The linkage is also called an SS bond or sometimes a disulfide bridge and is usually derived by the coupling of two thiol groups. Now I will draw a mucin molecule inside the mucus particle. I will show only two monomers and one disulfide linkage between them, but keep in mind that there are a lot of them. As you may already know, mucus viscosity is created mainly by the mucin molecules. Finally, we can get to the mechanism of action. Mucolytic agents such as N-acetylcysteine are absorbed in the bloodstream, then secreted in the mucus by the bronchial glands. So here you can see N-acetylcysteine in the mucus. Mucolytics such as N-acetylcysteine and carbocysteine are thiols with a free sulfhydryl group. Here you can see the sulfhydryl group. They break disulfide bonds between mucin monomers and between gel-forming mucins, thus reducing mucus viscosity. Here you can see how the mucin molecule gets torn apart and those two monomers are separated from each other. And you know another term for viscosity is thickness, right? That's why when the drug breaks the disulfide bonds, internal frictional force, or in other words, viscosity, decreases. Inhaled acetylcysteine has been used for mucolytic or mucus-dissolving therapy in addition to other therapies in respiratory conditions with excessive and thick mucus production. It may be considered ineffective in cystic fibrosis. The most commonly reported adverse effects for IV formulations of acetylcysteine are rash, urticaria, and itchiness. Up to 18% of patients have been reported to experience anaphylaxis reactions. Adverse effects for inhalational formulations of acetylcysteine include nausea, vomiting, stomatitis, fever, rhinorrhea, drowsiness, and bronchoconstriction. Although infrequent, bronchospasm has been reported to occur unpredictably in some patients. Carbocysteine is a mucolytic that reduces the viscosity of sputum and can be used to help relieve the symptoms of the chronic obstructive pulmonary disorder by allowing the patient to cough up sputum more easily. Carbocysteine should not be used with medicines that dry up bronchial secretions. Adverse effects can include severe allergic reactions, tightness in the chest, swelling of the mouth, face, lips, or tongue, blood in the stools due to gastric mucosa irritation. Bromhexine acts on the mucus at the formative stages in the glands within the mucus-secreting cells. Bromhexine disrupts the structure of mucopolysaccharide fibers in mucoid sputum and produces a less viscous mucus, which is easier to expectorate. Ambroxol is a metabolite of bromhexine. Ambroxol is indicated as secretolytic therapy in bronchopulmonary diseases associated with abnormal mucus secretion and impaired mucus transport. It promotes mucus clearance, facilitates expectoration, and eases productive cough, allowing patients to breathe freely and deeply. It acts through several mechanisms, including breaking up phlegm, stimulating mucus production, and stimulating synthesis and release of surfactant by type II pneumocytes. Speaking of side effects, field tests to date haven't uncovered specific contraindications of Ambroxol. However, caution is suggested for patients with gastric ulceration, and usage during the first trimester of pregnancy is not recommended. This concludes our lecture. Thank you for watching.